NAION.
Yeah.
Oh, there we go.
Again,
What?
take it back.
Let's try to get more specific.
Right.
Cannabis and glaucoma.
You're not going to like what I'm going to say.
NA.
No,
Interview's over. I gotta go deal with this.
not great.
Welcome to Get the Skinny, where experts unpack the ripple effects of GLP-1s one field at a time. I'm Zach Jacobs, the founder of Jurni GLP and a GLP-1 user who's lost around 50 pounds and gained around 500 new questions. They don't tell you that once the compliments fade, you're left with loose skin, new insecurities, and a totally different relationship to your reflection. We talk about side effects in medicine, but what about the side effects of success? That's why I started this series, not to talk about weight loss, but to talk about what happens when it works. And we are very lucky today to have a Philadelphia-based ophthalmologist, Dr. Ann Vo, spending some time with us to answer some hard-hitting questions around the eye and GLP-1s. Dr. Vo, it's a pleasure to meet you and have you on today. Could you please give us just a little bit of an intro around your experience and expertise?
Sure. So I'm an ophthalmologist. I've been in practice for about 10 years in private practice. My practice is focused around most things in the front of the eye. So, dry eyes, blepharitis, so inflammation on the lids, cataracts, glaucoma. So that's basically what I do.
All right, so you hit a buzzword, blepharitis. I get styes kind of frequently, and
Yeah,
this is a new thing for me.
okay.
Within the last 2-3 years.
Uh-huh.
What's wrong with me?
So you're not going to like what I'm going to say.
Uh-oh.
Don't get grossed out. Don't panic. So you want to see an ophthalmologist and see if you've got something called Demodex blepharitis. So this is going to sound really gross, but don't freak out. Demodex are these microscopic little mites, and they live naturally. So meaning they're endemic. Their natural environment is at the roots of your lids and lashes. So at the roots of the hair follicles. They can even be found in the meibomian glands, which are the oil glands that line your lids and lashes. And so they proliferate. And in some patients, they might really like your environment. They really like the oil. They really like the skin. And so they're basically overpopulated, and that can lead to, sort of very non-specific but broad symptoms like redness, itching, foreign body sensation, crusting. It can lead to sort of chronic inflammation on the lids and increase your risk for styes or chalazions, which is sort of like that localized infection, sort of like a pimple on the oil glands. Yeah, so you want to check and make sure that you don't have that specific type of blepharitis, because we actually have a treatment for it now.
All right, interview's over. I gotta go deal with this.
Get
But I think the key takeaway is that I have sweet oils and they like me.
They love it. I
think
mean,
that's the
just,
big
yeah,
takeaway.
it's a very nurturing environment, and they're just, building their civilization on there. So,
All right, well, I think that's the key takeaway. I have a nurturing environment on my eyes.
yeah, for the mites, yep,
Well,
they love it.
thank you very much.
You're
We'll deal
welcome.
with that at the end of the interview.
My job's done. I'm out of here.
There is my one free piece of medical advice.
Exactly. Yeah.
But so not part of, the inspiration for reaching out and connecting with an ophthalmologist is there
hmm
are these pending lawsuits against Novo Nordisk, the creator
Right.
of Ozempic.
hmm
It's not a class action lawsuit. It's defined as an MDL. There's around 2,000 different cases that have been lodged by users of Novo Nordisk weight loss programs, from pancreatitis all the way to NAION,
hmm
which is sudden vision loss.
Yeah.
And of the 2,000, what I've been able to find is like 41 are eye related.
hmm
And they really stem from the fact that Novo Nordisk doesn't properly label the medicine with like a broad warning. So before we get into some of our fun formats, I'm just kind of curious, has this kind of come up yet in your day to day, or do you have any patients on GLP-1s that are specifically asking about NAION? And then the final piece I'll dovetail onto that or tack on is it seems like the population of folks that are submitting these lawsuits do have type 2 diabetes. So like there's one publicly available like NBC News expose on one of the people that have submitted a lawsuit, and he's like over 60, I believe, has type 2 diabetes and didn't develop the sudden vision loss until 4 months into his treatment. And so I'm not discrediting him by any means. We're here to kind of uncover the truth and learn. But do you think, and not to put you on the spot, and we'll just have a talk about it, but like, is it the meds or is it the pre-existing conditions?
In medicine, we like to talk about correlation is not causation, right? So yeah, no, you can't tell. And unfortunately that happened, but that's exactly the type of patients who are at increased risk for developing an AION. So AION is specifically NAION, so non-arteritic ischemic optic neuropathy, where it's basically sort of like a stroke where the optic nerve does not get enough oxygen, and you
Hmm.
lose your vision. And so patients that have diabetes, that have cholesterol, atherosclerosis, hypertension, those are the patients that are at increased risk for developing an AION in the first place. So yeah, I
Okay.
don't know that you can directly parse out, the two. So yes, so diabetes, hypertension, age, those are all risk factors for developing a.
Gotcha. Because it's just, what's interesting to me as I go on my journey is that what like the main population sees are kind of these negative headlines,
Sure.
whether they're right or wrong. But that's what's like sticks in people's minds. And so lately, as I tell people I'm on one of the weight loss meds, they all, oh, well, what about blindness?
Hmm.
And so as I kind of crunched the numbers and looked into it, so if there's 2,000 lawsuits and something like 40 million-ish Americans on these medications,
Right.
it's like 0.00067% of folks responding negatively enough that they're lodging lawsuits.
Yeah.
Not to generalize, but it kind of feels like the that famous McDonald's lawsuit where someone burned themselves with coffee and they didn't
Mhm.
have the warning label and now they don't ever have to work again. And it seems like people are trying to like, a little bit of a cash grab, so to speak.
Yeah, I mean, I don't really, have an opinion about that. The developing an AON is dramatic, right? That's life changing.
Hmm.
That's a blinding, situation. So I get that patients are
No pun
looking
intended.
for patients are looking for an answer, right? And
Hmm.
like I said, it's just, correlation is not causation. And there's many, many sort of risk factors that go into it. Personally, for the patients that I treat and the patients that I see, many, many, many of them have diabetes. The diabetes is sometimes so severe that they require injections of medication into the eye. And so for a lot of these patients, the GLP-1s have been sort of like life altering for them in a good way, right? A lot of weight
Hmm.
loss. I don't do like injections inside the eye. I'm not a retina specialist. I do cataract surgery. And that has impacted my practice because we do have to be careful, to let patients know they need to stay off their meds at least a week before because it does delay gastric emptying. So those are sort of like the practical things that we've encountered. None of my patients have been concerned about vision loss because if they're seeing me, if they're seeing a retina specialist, they already have a certain degree of vision loss. And, that to them is much more quantifiable than these, unfortunate but relatively small case findings, I guess, or cases that are, out in this lawsuit. So
Hmm.
yeah, on a practical level for me, I think the patients have been pretty receptive to being on the treatment and have benefited from it.
Hmm. And then in your specialty, when you talk about going off the GLP-1s prior to an eye procedure
Mhm.
due to gastric emptying, is
Mhm.
that related to anesthesia or
Yeah, it's
something specific to the eye?
no, it's related to the anesthesia. Yeah,
Okay.
yeah.
Well, before we jump into some fun formats, is there
Mhm.
anything GLP-1 related or with these weight loss meds that something 5 years ago that you never heard in your consult room
I love
or
it.
a
Yes.
patient's never described? Like, is there something new occurring in your conversations with patients?
So, no, not necessarily in my conversation with patients, but I want to take it back to because I want to show off the research that I did.
Oh, there we
'Cause
go.
I did
Okay.
research
Yeah,
on
let's get
this,
into
right? And
Let's get into what you want to chat about.
I learned something new, right? So,
Okay.
we heard about these studies, and when the GLP-1s were first coming to the market, like I'm on this forum, I used to be on this forum on Facebook, Ophthalmology Moms, and people would like start talking about it, like saying, hey, have you guys seen this? And the consensus was like, no, not really, we haven't. But now there's actually studies, right? And so there's been one study that has shown a positive association between, patients that have diabetes and that are on the GLP-1s and that developed the NAIONs. But the problem with the study, there's only 46 cases in the study, which is not a lot. So it's a case study. It was out of one institution. So that's the problem, is it's a very limited group. Specifically, like I was reading the study, it's from a neuro-ophthalmology group. And so it's sort of like a selection bias there, because these are the patients that are going to get referred to this clinic because it's a tertiary referral clinic, right? So this is sort of like what they do, what they see. The one study, it shows a positive association, but that's it. There's 3 other studies, and these types of studies, they're not like randomized double-blinded studies, right? So the type of studies, the scientific studies that you do, obviously the ones that are sort of like the strongest evidence is going to be a placebo, random, double-blinded. So these are not that. These are retrospective cohort studies, meaning you're looking back at things that have already happened and trying to make an association. So there are 3 other studies within the last couple of years. Hundreds of thousands of patients now have been, looking back at the diagnoses, and those studies have not shown an association between the two. Again, association is not causation, right? Correlation is not causation. But if we're just looking at like association, there is no established association in the studies that, have been done other than just the one. So that's the one thing, that I sort of learned. And then the other thing, which is personally to me more exciting, is the fact that there are, I think, 3 studies that have shown that patients that are on these GLP-1 drugs actually show a greater risk reduction for the development of glaucoma. And I think that is super interesting and definitely an avenue that I'm super excited about, because glaucoma is devastating. Diabetes can be devastating, and these are sort of irreversible causes of vision loss that are extremely common. That's more common than AIONs. And so the fact that that's sort of, showing that there's a reduced risk for those patients, I think is very interesting. And I'm very excited to sort of, see where this leads.
All right, you spurred some questions in me.
Yeah.
What is glaucoma?
Yeah.
What are people with diabetes or obesity, overweight, more at risk for glaucoma?
Mm-hmm.
And what are current common treatments? And is glaucoma reversible? As someone living in California, I hear about cannabis and glaucoma,
Yeah.
but now it could be GLP-1s.
Yeah. So glaucoma, simply put, it is a disease of the optic nerve, is a progressive optic neuropathy, right? So the same anatomic structure in the eye. The optic nerve is the cable that runs all of the information from the eye to the brain. And it is consisted of approximately 1.2 million nerve fiber layers. And those nerve fiber layers can be damaged by high pressures in the eye. So they sort of get plucked off, a few at a time until it reaches a crisis point, and then you start losing vision. And glaucoma is dangerous because most of the time, there's different types of glaucoma. This is like it's a huge study. There's like a whole separate society, and we know people do a whole separate fellowship about it. But, essentially, we know that patients that have diabetes are at increased risk of glaucoma. So they're sort of like independent risk factors for each other, right? So one gives you increased risk for the other and vice versa. And we don't understand everything about glaucoma. The more that we learn, the less we sort of know, essentially. But we do know that we treat glaucoma as much as we can by lowering the pressure in the eye. There's no cure for it. And once glaucoma damages the optic nerve, any damage is irreversible. So damage to the optic nerve is like damage to the brain. It's irreversible. So we lower the pressure in the eye by using medications to lower the pressure, by using a laser in the office to lower the blood pressure, and then surgery. And most of the time, surgery is sort of more advanced. And so we save the surgery for more advanced cases or cases that can't be managed medically.
And after preparing for this, have you been jumping into the Ophthalmology Moms forum and
I quit Facebook. So
oh
I'm not on
no,
there anymore, but I have to ask Kelly, Dr. Williamson, because she and I were on that group together, and I quit Facebook, but she's still on there, so I'll have to ask her.
all right, well, congratulations on your quitting Facebook cold turkey. That's quite impressive.
It wasn't culture. I did it once, and then I got back on it, and then I was like, no, and I did it again. I quit it again.
I'm behind you, Shorely. I got spending too much time and this stuff's too crazy these days.
Yeah.
All right, which is a nice natural segue into our first section here, a
Okay.
red light, green light. So I'm
Okay.
going to hit you with a prompt,
Hmm.
and whether it's, serious or bad, it's a red light.
Hmm.
And if it's kind of harmless or not something to kind of worry about, that's a green light.
Okay.
Blurry vision in the first few weeks of a GLP-1.
Green light, yellow light.
Mhm.
Hmm.
Have you heard about that? So it's like all over Reddit forums that people
No.
experience blurred vision in the
Mm-mm.
first few weeks of some of these medications. So that's where that
Yeah,
one comes from. Okay. Sudden vision loss in one eye.
that's a red light. Yeah,
Waking up with a dark curtain across your vision.
red light.
Eye pain associated with blurry vision.
Yeah, that's a red light.
Double vision that suddenly appears overnight.
Red light. I hate all of these, by the way.
Dry, irritated eyes after injecting your GLP-1.
I don't know.
Glasses feeling too weak after losing 20 pounds or more. Like your prescription feeling weak, not that you're too weak to support them with your face.
I would say that's a red light. I think the thing is that like you should get all of these checked out because they're too non-specific. Do you know what I mean? And I think that's what my problem is with it. It's just like I hate all of these because they're too non-specific.
Let's try to get more specific. What about seeing stars when standing up on these medications?
I guess yeah, that's a red light.
All right, well, we survived red light, green light. We're moving quickly into fact versus fiction.
Okay.
And hopefully they're more specific. So, fact versus fiction. Obesity itself raises your risk of vision problems.
Yes, fact.
Fact. Diabetes is the number one cause of blindness in working age adults.
Ooh, in the United States, I want to say yes, fact.
Most blurry vision is only temporary.
Yeah, that's a fact.
Losing weight can reverse diabetic eye damage.
I'm gonna say that's fiction. It can't reverse it. Yeah. So there are some patients that have really well controlled, hemoglobin A1Cs and still sort of progress with their diabetic retinopathy. So I'm gonna say no. Yeah, fiction.
NAION is rare but permanent.
Yes, fact.
Sleep apnea can damage your eyes.
Yes, fact.
Cataracts are more common if you're overweight.
I think that's fiction.
Carrots and blue light glasses actually do help improve and protect your eyes.
So that's kind of like half and half. So carrots, no, right? We know that vitamin A is important. And if you are lacking in vitamin A, like deficient, you could have, serious dry eyes that's pathologic. The blue light thing, I think there are some studies that have shown that, having a blue light filter is protective for patients that have retina issues. But, for patients that sort of use it over the counter for like computer work and stuff, I don't know that the data bears that out. So
Follow-up question, are you currently wearing blue light glasses?
no.
Okay, there we go. There's the answer. Into a new innovative format, swipe left or swipe right.
Okay.
Every GLP-1 patient should get a baseline eye exam.
Right.
All
I gotta
right.
say it. I'm gonna get confused. That's right. Yeah.
Sleep apnea can make you go blind.
Yes.
Rapid weight loss makes you need new glasses or a new prescription.
No.
Bear with me on this one. Idiopathic intracranial
There
hypertension
you go.
is basically a, is base. Let me try again from the top. Idiopathic intracranial hypertension
There you go.
is basically a brain tumor from obesity.
No, that's a left.
What is it?
One of the other names for it is actually called pseudotumor, meaning false tumor. So there's There's no tumor there. It is when there's fluid buildup in the eye. So there's compressive damage, to your brain, to the optic nerve, but there's actually no physical mass or anything there. So it's called a pseudotumor. So that's why
Okay.
it's false, because there's actually no tumor.
Heard it here first. Last one. Doctors don't really know why NAION happens.
Yeah, that's right. Mm-hmm.
Thank you. We survived that round. All right, so this is called Rate It. And I'm gonna throw out a prompt and you're gonna give me a 1 to 10 of, 1 not serious, 10 very serious.
Okay.
Losing 20 pounds can lower your risk of glaucoma.
I'm gonna give that a 4.
Obesity is the #1 risk factor for pseudotumor cerebri.
An 8.
If you start to experience blurry vision, especially on a GLP-1, it usually dissipates in 3 months or less.
That's probably like a 7 or an 8, I would say.
Dry eye is the most common complaint you hear from weight loss patients.
I don't know. I don't know about that one. I have no opinion.
NA. Is there a common thread that you've heard from any patients that you're aware of on a GLP-1 weight loss med?
No, they don't really complain about their GLP-1s. I mean, they're happy about it.
And I don't know how many patients you have on GLP-1s or anything like that,
Mhm.
but assuming you do, none have complained about any of the things I'm talking about.
No, I mean, patients have complaints, but they're like, I guess my question is like, are they complaining and asking if it's their GLP-1, or like, are they complaining and then do I check the chart? Or are they on a GLP-1?
I guess we'll do a role play. So, hi, I'm Zach, and I'm your patient.
Mhm.
I've on Ozempic.
Mhm.
I've come in and have I complained to you about blurry vision, dry eyes, sudden vision loss, seeing stars when I stand up, anything of the sort that you can think of.
I mean, no, it's like if you come in and you're like, well, I just started Ozempic, like, and I'm having all this stuff, that hasn't happened.
Okay.
But, I mean, those are sort of, I get those complaints all the time because I get blurry
Okay,
vision.
but so
Exactly.
we get the complaints, but not necessarily tied to,
Yeah.
hey, I've
Exactly.
started one of these medications and now I've noticed
Right.
1, 2, or 3 things.
Yeah. Yeah.
Higher risk, diabetes itself, or starting a GLP-1 drug.
Diabetes itself.
Like, what's more worrisome, NAION or diabetic retinopathy?
AION.
What's the bigger vision killer, high blood sugar or high blood pressure?
Sugar. Blood sugar.
Got to fix the sugars. All right, so now we're moving into before you prescribe. So what's the one eye exam everyone should get before starting a GLP-1?
A comprehensive dilated eye exam.
And do you have like the nice sunglasses in the office
Yeah.
that you send people home with, the big ones?
Little slippies, yeah.
How often should GLP-1 users or diabetics get eye checkups?
So diabetics, if they have no retinopathy, need a dilated eye exam once a year. I think if you first start, I guess to be safe, you probably should get like one every 6 months. I mean, it depends on whether or not you have any retinopathy, and then that will of course change, the follow-up that's recommended.
So diabetic retinopathy is on the warning label, and of at least Wegovy and Ozempic. I've used the Novo Nordisk products myself. Can people with diabetic retinopathy begin these medications?
Yeah. I mean, we have plenty of patients that have diabetes, have retinopathy, and begin them. Yeah.
And is there any specific advice or warning or coaching that you give these patients, or just stay in constant communication and reach out if anything starts to change?
Yeah. So I'm not a retina specialist. So when patients have diabetic retinopathy, and I think it needs further monitoring, I can diagnose it. But if I think it needs treatment or intervention, we'll normally refer to our retina colleagues, so you need a retina specialist. So that's what I would recommend.
All right. And so based on your fantastic research you did, and I thank you for that, and your expertise, what's the #1 thing you think people are getting wrong about these GLP-1 medications and eyesight?
I mean, I think we have to be really careful about, making the relationship either way, right? I do think that it needs to be monitored because AION is so devastating. But that being said, glaucoma and diabetic retinopathy are also extremely devastating. And, a lot more of the data has sort of shown that there is some sort of like reduced risk there. So I think, before we panic, I would say that it's been I think, positive for patients so far. And so,
Hmm.
I think importantly is you need to see a doctor. Like, don't just start the medication. Don't like get a baseline eye exam. The thing that sort of worries me are the younger patients that are getting them prescribed like through telemedicine. That's really my concern. Is that, you do need just like a basic eye exam to make sure that like get a baseline so that right? And so if there's any changes, well, then here's what you compare it to, rather than just, saying it's definitely because or of this or definitely because of that. I don't get hate for that because, I know.
No, I'm about to follow on and agree with it because I never listen when I started this journey of mine.
Hmm.
I started in October 2023.
Hmm.
Never would have ever considered anything was related to my eyes as
Hmm.
it relates to my GLP-1 usage or weight. Just
Hmm.
uneducated on that. And then my big regret is so actually my cardiologist put me on it
Hmm.
and he gave me a like a lab slip to go get my blood work and a
Hmm.
prescription for Ozempic. One, I was in such a shame-ridden spot that I didn't want to know if I was pre-diabetic or not. I didn't want to
Hmm.
go get the blood work, and I didn't think the medicine would work for me. So I didn't get the baseline blood work. My biggest regret. My biggest regret. So now everything is perfectly green. I just got some blood work in August,
Yeah.
right in the middle on all the different tests that were run. But I really have no idea the progress or improvement I made or where I actually started.
Hmm.
And so that's goes for blood work, eyes, so on and so forth.
Yeah, and I think that's important, especially even if it's not associated with it, right? If the number is so low, like I mean, you kind of just want to know.
Yeah, it's nice to know, but
Yeah.
it's what is inspiring to me about these medications is that with 80% of the US either overweight or
Hmm.
obese, sorry, with 40% of the country being actually obese, think
Hmm.
about how many people are not interested or too like me, riddled with shame to go get the blood work, to come see an ophthalmologist and figure out what's going on with their eyes and the
Hmm.
sty in their eye. Think about the myriad of health concerns or issues that people are just put into the wayside because they don't want to actually know or look into the mirror or face the reckoning of things. And what I'm optimistic about and hopeful is that as more and more people like myself kind of wow, like I lost 50 pounds, I put in the work, like I work out every day, I changed the way I eat, deleted Uber Eats off my phone, which was the hardest breakup I've ever had. I think it's going to usher in a new era of like health conscious like super soldiers
Yeah.
so to speak, where and not that you need to go do some insane 2 hour a day workout, but you're just more conscious of it. You're more excited by the progress you're making, this huge trend of weighted vests and walking and getting your steps in. And you know what, that's a great thing. Like why not have people be more motivated and actually whether it's a 1 mile walk, a 30-mile hike, whatever floats your boat. But it's, I think, kind of exciting to see that this potential shift's occurring
Yeah.
in
No.
the broader population. One thing I wanted to kind of dive into just before I let you go here and escape me, and like brought it up in a little bit earlier, but the correlation between sleep apnea and eyes.
So sleep apnea is basically when you stop breathing when you're sleeping. And so you do it in these little increments, and your brain has to sort of like wake you up and be like, hey, take a breath because I need oxygen here, right? It's a relatively hypoxic state. And that's what AION is. It's ischemic optic neuropathy. That's sort of the association is like the hypoxia where you're not getting enough sleep. When we think about that, it also ties back to glaucoma too. There's a subset of glaucoma called normal tension or low tension glaucoma, where the eye pressure in the eye is not high. It's still what we consider normal or within normal range. And patients still have glaucoma or worsening of their damage. And so we sort of then look at these things like sleep apnea, like why are you not getting enough oxygen? So sleep apnea, we do the sleep study test to sort of rule out to make sure that, hey, like to make sure you're not hypoxic essentially. So it's
Gotcha.
a hypoxic state.
Reason it came up, Zepbound's the first medicine ever approved by the FDA to treat sleep apnea.
Oh,
Zepbound's a GLP-1 medication.
yeah.
So you see the little FBI spider web. I'm
Yeah.
starting to connect. Like, yeah, sure, there are people experiencing negative side effects, like they do with every medicine on Earth.
Right.
Now, Tylenol.
I have
We
opinions.
don't need to
Let's
get
not
there.
talk about it.
Let's not go there. But it's like, I never would, before preparing for this conversation with you, I'd never think my sleep,
Mm-hmm.
especially when I'm not breathing, not that I have sleep apnea and not that there's anything wrong with it, but like I would never connect those two things, right?
Yeah.
And now you're seeing the use cases for these GLP-1s going from diabetes to obesity and weight loss to things like sleep apnea
Mm-hmm.
and it's heart disease and so on and so forth, addiction,
Yeah.
a lot of things that are with heavy obesity or overweight being the precursor, but it's kind of an exciting times in the medical field around these topics.
Yeah, no, I mean, like I said, the more that you find out, the less that you realize you know and understand. And I would just caution, there's no like wonder drug or like miracle drug. Like the one thing isn't going to fix everything, right? But we got to use what we have, and like do the studies and analyze the data and not just, do your own research.
Yep. I got a friend phoned in a question. They got LASIK when they're 18.
Mhm.
Now they're 28.
Yeah,
The LASIK's weakening or dissipating.
sure.
And the question is, are their eyes salvageable? Can they get lens implants?
So, yeah, you can always retouch the LASIK. So the answer is yes, but with caveats. So yes, they should definitely, see an ophthalmologist. You could get the LASIK or refractive surgery retouched. My opinion on lens implants is guarded, I would say. I think for a certain subset of patients, they really benefit from it. Like if you're so nearsighted that, LASIK isn't going to work because it's going to shave off too much tissue. I think that's great. I think it really can, benefit your quality of life, but it is surgery inside the eye, right? And so you kind of literally open the can of worms because you're going in there for, retinal tear, retinal detachment, cataract, glaucoma. And those things are, not great. So yeah, so definitely retouch before you consider a lens implant.
Going to the implant.
Yeah, exactly. Yeah.
And that's why we're so blessed to have an MD like yourself helping educate. Is there anything that we missed or that you think is important to share
No, no,
with
I
a
think you
global
covered it.
audience once we go super viral?
Oh my goodness.
Really appreciate your time today and hope you have a great rest of the day and the week. And thank you, thank you, thank you.
Yeah, this was fun. Thanks for having me.
You got it.
Thanks. Bye.